Okay, so let me talk about a couple of the national solutions that you might know about and how they address these three problems, and then we'll zero in on Massachusetts. Many folks, I suspect in this room, lots of people in the country of progressive spirit, would like us to see us move, like Canada and many other countries, not all of them in Europe, but some, France is another one, to a single payer system. And a single payer system does solve all three of those problems. So you pool the entire nation, sick and healthy across the nation. You're born into this as an entitlement. It's obviously affordable in the sense of buying it because you pay for it through taxes, so it's free. And under a single payer system, you don't really need a mandate because why would anybody turn down free care? You know, it's sort of a default entitlement. But it faces three really difficult problems. One is it threatens the largest segment of our economy. Remember, this is 16 times larger than what some of your neighbors who are ranchers do, and then what is the main industry for, what, I don't know, 20 states in this country, than agriculture. It is huge, and we haven't really done anything. I'm not sure I want to say it this way, but you'd have to go back to Lincoln's proclamation or some of the Depression-era things that Roosevelt did to find this kind of transformation of an economic sector. It's not something you do outside of crises. Maybe wartime. It does, frankly, not meet the needs of most consumers because most consumers have insurance and they're actually very insecure about losing it or about changing it. And that's certainly what the campaign against Clinton healthcare in the 1993-94 era played on those fears. And it would also, and here I'm talking about insurance specifically, nationalize a $500 billion industry, which is you know, a pretty good chunk of change. So it's got some problems. And frankly, what I say to people who, my friends on the left who say, well, you know, how can you have this mixed up crazy system? And the system we've designed in Massachusetts is extremely complex. And my answer is, well, I could wait for a single payer system, but it's sort of like that joke of, which may be now in bad taste, Ted Kennedy, well, one of the Kennedys dies and goes to heaven, and St. Peter says, and do you have any wishes? Do you have anything you want to know? And he says, yes. Will we ever get national health insurance? And St. Peter says, yes, my son, but not in my lifetime. We could wait for single payer, but there'd be a lot of people dying in the meantime. On the right, there are basically, and this is going to, when I talk about McCain, you'll see the similarities. The idea is somehow employer-sponsored insurance is getting in the way, and it's very inefficient, and we need to have tax credits, direct credits, to offset the cost of non-group insurance. And if those are large enough, and that's basically the concept. Let's do away with the deductibility of employer-sponsored insurance. You know, when you get $5,000 or $10,000, those of you who are lucky enough to, well, when you were working or if you were working for a company and you get it, you don't pay tax on the imputed income of the $5,000 or $10,000 that your employer is setting aside for family coverage. That's tax-free. And so the idea is do away with that, do away with more tax subsidies for richer people and less tax subsidy for lower people, and just give people credit. And if large enough, that would address affordability. It's certainly much more politically feasible, but it too has a number of fatal flaws. First of all, half the uninsured don't pay taxes, so giving them a tax credit might not be too helpful. There's no pooling mechanism. There's no way to bring the bad and the good risk together, the broad spectrum of risk. And it would frankly only deliver modest coverage increases at realistic levels.